COVID cases surge again. More than 100 countries see a rise in new infections. So why are numbers soaring? And are we in danger of worse to come? I'm Andrea Sankey, and today's newsmaker is COVID-19. It's been 2.5 years since COVID-19 first emerged, and by this point, some thought the virus would be forgotten. But instead, many countries are facing yet another massive wave of infection. Cases have jumped by almost a third globally, and like so many times before, the World Health Organization is warning the pandemic is far from over.
We have made progress, but it's not over. Our ability to track the virus is under threat as reporting and genomic sequences are declining, meaning it's becoming harder to track Omicron and analyze future emerging variants.
Well, the latest surge in infections is largely down to two Omicron subvariants, BA.4 and BA.5. The mutations appear more resistant to vaccines and are very difficult to track. And with summer holidays in the Northern Hemisphere now upon us, there are fears the virus could spiral out of control. Some scientists say it's time to think about reintroducing restrictions to avoid catastrophe.
Vaccines are brilliant, but not enough. Nobody wants to go into lockdown or do anything restrictive if we can help it. But we need to say, here are the tools, we would like you to use them.
Now, some authorities are reimposing restrictions. Masks are once again compulsory in Qatar. China was considering going a step further and introducing a vaccine mandate in Beijing, but some inside the capital were resistant and made their feelings known.
The mandate says people who aren't suitable to get vaccinated can be exempt from vaccination. But how do we prove this? Who's going to issue a certification for us? You have asked lots of doctors and they all said you can't. That means you are indeed not suitable for health reasons. But no one dares to give you the certification. I can't force myself to get vaccinated. I'm not going to risk my life.
Well, in that case, public pressure seemed to work, leading Chinese authorities to reverse the policy on Friday. Meanwhile, scientists continue to emphasize the importance of a global vaccine rollout. Last year, the World Health Organization said it wanted all 194 member states to have fully vaccinated 70% of their populations. But just 58 nations have hit that target so far. And according to Oxfam and the People's Vaccine Alliance, of the more than 2 billion vaccines pledged to the world's poorest nations, less than half have been delivered.
Well, we need concrete action to cope with the multiple crises of our times. That means the G7 have to act immediately. They have to fight hunger, inequality and poverty. They have to do more against climate change. And they have to ensure that everyone worldwide gets access to vaccines, medicines and diagnostics in times of the COVID-19 pandemic. And that means they have to put people before profit.
So to talk more about how the coronavirus is behaving now and how we should manage it are from Open Scotland, Dr. Daniel Goyal. He's a medical consultant with the NHS. From London, we have Dr. Mohammad Haqmal, a public health expert, and he's a lecturer as well at City University. And from Geneva, Emanuele Capobianco is Chief Strategy and Impact Officer at the World Health Organization. Thanks all so much for being with us. Daniel, you were very disturbed back in April by the lifting of basically all restrictions in the UK. So 3 months later, do you think your concerns were vindicated?
Yes, absolutely. The devastation that these waves of COVID, I think we're on our third wave in 6 months now, has caused not only to people's lives, but to healthcare systems and also to the economy has been, something to behold, really. So yes, I think it was a mistake to cold turkey us and just shut down all restrictions immediately, and definitely should have been more graduated, and we may need to revisit that.
Explain, though, because we know case numbers are surging, but we're hearing there are fewer hospitalizations because of this variant and its milder symptoms in general. So how bad has it gotten for the NHS? What are healthcare workers actually up against now?
It's the worst it's ever been for us.
Really?
I mean, absolutely. We're losing staff quicker than we've ever lost staff before in terms of resignations. You have to put this in perspective that each time a wave comes, it's a cumulative pressure for us. It's not sporadic pressure that then just goes when the wave goes. We've got the backlog, we've got all the misdiagnoses, we've got sicker and sicker patients coming into hospital. And you could see that very clearly in the waiting times for ambulances and A&E, the highest they've ever been in the history of the NHS. The 12-hour waits in A&E have led to thousands of people dying since January. It is crisis in the NHS doesn't seem to really measure up to how bad it is at the moment.
Dr. Goyal, why are we not hearing more about that, though? Specifically what you're telling us.
Yeah, I mean, we are hearing, I think it's, the president of the Royal College of Emergency Medicine has been very vocal about this. There was a big debate in Parliament yesterday about it. Unfortunately, the antics of our current administration and government have, overwhelmed all the media, and we're not getting the attention that it really needs. But I'll say it very clearly, the lack of ability to provide emergency care to the public of the British is really one of the biggest threats that we have in this country at the moment. It is an hour in many places around the country to get an ambulance from the time you call to say, I've got crushing central chest pain, could well be a heart attack, going to take an hour for an ambulance to get to you. It's never been like this before. Cancer, yeah, and cancer wait lists are probably the most tragic of all, really. Thousands waiting 3 months for treatment. It's really quite bad, and really it's due to bad leadership.
Okay. Dr. Mohammad Haqmal, you were also in the UK. Are you on the same page as Dr. Goyal there? Do you think that the authorities really did lift restrictions too soon, and it's now putting almost immeasurable pressure collectively over the last year in particular on the NHS?
Well, I'm absolutely agree with Dr. Goyal what he mentioned. In addition to that, my main focus on research is also in developing countries, specifically in Southeast Asia countries. I think the Southeast Asian country can also learn from the experience that we are having today here in UK. So unfortunately, the vaccine coverage is also very poor in developing countries. And unfortunately, people are also not taking any sensitive issues to consider also the preventive measure. So, and in the same time, also the testing coverage is also very poor. And I think what the Southeast Asia country and also developing countries also can learn from UK and also from other developed country is very important for them, to think about these, to increase the vaccine coverage, think about, the restrictions of movement, and also apply most of the preventive measures that have been also recommended, by World Health Organizations in order to control, these any upcoming wave of the COVID-19.
Okay. Emanuele Capobianco, I mean, let me ask if there's any silver lining to this and all these surges and yet another wave. Are we in any way building a better tolerance to this virus? We've already been told that herd immunity has been scrapped. But is there anything good about dropping protections, the regulations that we had, mask mandates, et cetera, in order to get people more exposure to COVID-19 so that we can become a stronger, immunely stronger population?
Well, the first point, just to react to Owen's, is that globally we are seeing an increase in cases in 110 countries. Last week, we had 4.5 million cases and 9,000 deaths. That means 1,000 people dying of COVID-19 every week. So this remains a critical priority globally for the public health sector. We have learned a lot through the past difficult 2 years, and the silver lining is that we do have instruments that can protect and save lives. And this one goes from simple protection measures like wearing masks, like staying outside and avoiding crowded places, to the vaccination that has proven successful. And a recent report of the Lancet estimated to 20 million lives, the number of lives that have been saved by vaccination. And also we do have antiretrovirals that can save lives. So we have a lot more weapons, if you want, at our disposal, but these are not equally distributed in the world. And priority is to make sure that these instruments are in the hands of people who need the most, who very invariably are in low and middle income countries.
Okay, but can we at least say that the new strains will not return the virus to its former strength, as I was asking about silver linings, or could it still spread viciously and mutate again and then return to being highly life-threatening as it was in variants prior?
I hate to use the words "I don't know" because I feel nobody has 100% certainty that a new variant with potential higher mortality will emerge. It's a possibility, and I think the world needs to be prepared for this possibility while dealing with other variants that luckily have lower mortality, but as I mentioned before, are still killing around 9,000 people every week. And so we cannot lower the guard. And I think that's the recommendation number one. And we need to be prepared for the future and for the present, because at the present, numbers are soaring in many, many parts of the world.
Okay. Dr. Goyal, let me return to you. You know, we're talking about getting more booster shots and still more people vaccinated. But have the vaccines even been adapted to the Omicron variants? Because if not, some are asking, what's the point?
Yeah. I mean, vaccines have been far more successful than we could possibly have imagined. I mean, at such short notice to develop these vaccines that reduce the chance of death and severe illness has been a game changer for us. I can tell you, you know, if someone had come in 2 years ago to the hospital, we would be crossing our fingers to see if they would survive. Now, if they're fully vaccinated, we fully expect them to survive and would be very disappointed if we couldn't pull them through, whether, as my colleague says, all the extra tools that we have as well. So vaccines have been hugely, hugely game-changing. They haven't been adapted. I believe there are vaccines in development that hopefully will address that. But, you know, the message is, if you haven't had your booster, if you're not up to date, you know, you really are playing with fire. Get out there, get your booster, because particularly in countries like ours, and I think probably a lot of the low-income countries too, it's your first line of defence. If you do not have the healthcare capacity to properly treat people, you are dependent on them having that vaccine in the system and that immunity wall. So yeah, definitely excited that there will be more better vaccines coming forward as well.
Okay, because I mean, the virus has technically gotten weaker. These new strains are less life-threatening, but they are so much more contagious. What really are, you know, the worst aspects, do you think, of these new variants? How sick can they really make us?
Oh, wow. I mean, you know, a lot of it is, you know, they're not a lot different than the very first strain in terms of severity rate, and it's just that we do have immunity to them and we're much better at treating them. And they certainly.
So am I misunderstanding? Because generally it's believed that the new strains are less severe. Is that not true? Are they only less severe because we're vaccinated?
Yeah, so it's a hot topic, really. I think they probably are less severe, certainly than Delta, which was probably the most severest one we've had. But in terms of the wild variant, the first variant that we had, we faced that unvaccinated. You know, I think what we're seeing in people that are completely unvaccinated, not exposed, they have very high rates of getting admitted to hospital and high mortality rates relative to the others. So it's not this variant is very mild. Absolutely not mild. This is still a very serious illness, you know, much more serious than the flu. And it really is our immunity wall that's built up that's managed to take the sting out of it a bit. But yeah, we can't become complacent on this. We really do have, and I think that's part of the problem is, particularly in my country and I think a lot of countries around the world, they're trying to tell us that, you don't need to worry as much, oh, it's over, get on with your day. And that message is just dropping people from getting vaccines. They're not coming forward to get vaccines. They're not taking those protective behaviours, the masks, opening a window. Oh my God, what a difference opening a window makes. And people aren't educated about that. And I think, as my colleague said, we have dropped the ball in a lot of countries. And what we're seeing now is health damage, economic damage, societal damage because of it. And it's a shame because we could do so much better.
And there's also, Dr. Haqmal, the question of how much immunity we're now building via a previous infection, because we're hearing about people getting infected 3 or 4 times within a matter of months. You used to be able to even use documentation of a previous infection in lieu of a vaccine certificate. But is it still the case that if you have a COVID infection, you are somewhat protected, or with these new variants, has that been dropped?
Well, we have been learning also from the new variants, because to be very honest and also clear with the audience, and so we are learning from the new variants in terms of severities, in terms of also the infectious, how faster they can also spread. So my recommendation as a public health expert is, again, focus on the vaccines, focus on the preventive measures. So the health system need to be prepared. We should not underestimate the risk of the new variant. And also people should also closely also help the health system, because if the chance of the transmission is very high, then there is least likely, unfortunately, that the health system will be also able to provide the required services. So now the vaccine is effective, the preventive measures, we know that one. And we know if we don't take care of this preventive measure, how can also damage also the societies economically, and also the health system and others. So my suggestion is just to focus on the preventive measures, still go and try to get the vaccine if if anyone missed to get the booster dose. So this is already proven effective measures, rather than imagination, something that we don't know about.
Okay. Emanuele Capobianco, a phenomenon that is still very much out there is that of the anti-vaxxers. I want to ask you both about the impact they have had and the impact they might have going forward. Some of them are now arguing that, see, we didn't get vaccinated. We heard all this talk that if we didn't get a certain critical mass of the population vaccinated, we wouldn't see the virus weaken at all. But look, it has. At least this is what they're saying. So we're talking about needing another vaccination campaign, more boosters, and the anti-vax movement is still out there. So how damaging have they been or not been as per the development of this pandemic so far?
I think the entire world had to deal with a very high degree of misinformation, and the anti-vaxxers somehow were spreading information that was not correct, and have been continuing to spread information that is not correct. I've already said the statistics published on the Lancet just last week, that 20 million lives have been saved because of vaccines. And I think that's the biggest response to the no-vax movement. That said, we know that there is, on one hand, fatigue in the general population after 2 years of a pandemic that is unique in the history of recent history of our humanity. And we know also that that people are in need of reassurances psychologically that this is going to be over. And I think the most important element is to provide the reassurance that vaccines do work, that vaccines save lives. And if it's a 4th dose or a 5th dose that will prevent our we should go for them. If it's that will avoid people who are sick with cancer.
Okay, Emanuele, it looks like your connection is unfortunately dropping. We'll come back to Emanuele in just a minute. Let's try and correct your connection, Emanuele, and I'll pick up again with Dr. Goyal. If you want to pick up on the anti-vaxxer movement, how damaging it may or may not have been and might be in the future, do go ahead. But I also want to move on to issues of long COVID with you. Go ahead, Daniel.
Yeah, absolutely. I mean, I think this pandemic will be remembered as the pandemic that brought disinformation and misinformation into everybody's home and cost a huge amount of lives. I mean, there's no question about that. And I think, you know, part of the US's contribution to this is platforming anti-vaxxers and COVID deniers and allowing their message to spread around the world. And I think it's showing just how fragile the sources of our information are. It is one, you know, the saddest moment you'll see is having someone come in, you know, gasping for breath, and asking them the question, you know, did you get vaccinated? And you know, they turn around and say they didn't.
Right.
It really is the horror on their face. And I'm afraid we can't hide the horror on our face because we know we're back 2 years and we're going to have to fight really hard to survive, to try and help this person survive. And then you bring up the...
Did the movement cause lasting damage to the effect of the overall global vaccine campaign, health-wise?
Undoubtedly.
It meant that the virus actually was able to become stronger because of so many people not being vaccinated?
I am sure that is the case, absolutely. You know, we do know that viral load is lower in someone that's vaccinated, so by proxy, there'll be less virus for it to mutate. Okay. And I've heard from colleagues all around the world that, you know, I was speaking to a colleague from Nigeria who was saying they had to go door to door. And one of the commonest reasons they had for refusing the vaccine was, you know, they were implanting chips in them. You know, they heard from the States that, you know, these vaccines are bad and, you know, really very, very poor public health messaging and responsibility by these people, really.
Right. Okay, actually, Dr. Haqmal, I'll ask you about the long COVID issue. I just want to give everybody equal time because I need to know how much we actually know about long COVID and how long it really is. Do we even know kind of the maximum time it can linger and whether it does ultimately even affect brain performance, as we're hearing? How much do we really understand about it?
Well, it depends on the political commitments of different countries, if you see specifically the leaders. So the better we increase the coverage of the vaccines, so the sooner we can understand, you know, about the durations of the pandemic of COVID-19. So again, it is also not only political commitment, it's also the societal support. So we have experience of country where they also had, you know, very close collaboration with the health system, and also they were listening to those scientific advice, like South Korea, like New Zealand, Taiwan, and Vietnam, in other countries. So they were able, you know, to defeat, you know, the pandemics very effectively and also very efficiently. We also have country, very strong country in the world. For example, US and UK, and I think it was 45 days before the first cases of COVID-19, the Global Health Security Report were released, and UK and US was the first and second country in the world in terms of preparations for the pandemic. But unfortunately, when the leaders, they were not listening, you know, to the scientists, they were not applying, you know, those scientific recommendations. Unfortunately, we have seen even least developed country, like I give the example of Vietnam, Taiwan, and also South Korea, and even New Zealand. So they were more successful. So now I think it is a good opportunity for the scientists, for the public health people, to bring, you know, those examples to the decision makers and also to the society. Tell them, well, if you listen, you know, to the advice of the scientists, advice of those public health experts, advice of the clinicians, you will have, you know, that chance. If we don't listen to them, then we will also have, you know, the chance that even we don't know for how long, you know, these pandemics will also continue.
Okay. Was hoping to hear a little bit more about long COVID, but we only have 1 minute left. And Emanuele Capobianco, I need to ask you this question before we wrap up. You know, the Northern Hemisphere is hitting the height of summer, and we're looking at a massive wave of infections. So what should we actually expect in the winter? What are you most worried about when the real viral season hits?
Well, I'm worried for the present, and I think we should be picking up precautions, using masks, avoiding crowded places, vaccinated old people and at-risk people right now without waiting. And then we should be preparing for the future and being able to step up if the number of cases will increase again. And let me just go back to your point before. Long COVID is a big issue. And we have 2% of the population suffering of long COVID for a long period of time. These are lasting consequences that we should be avoiding at all costs. And to do that, prevention.
Quickly, how long is a long period? Are you talking months or upward of a year?
We don't know yet, Andrea. We don't know yet, but can be years. And this is a debilitating disease. It can become a chronic disease, so not only an acute disease. And that's why preventing infection is the way to go at the moment and in the future. And we have the tools for that.
Emanuele Capobianco, I'm going to let you have the last word. Very unfortunately, we're out of time for this edition of The Newsmakers. I'd like to thank all three of my panelists so much for being with us. Our viewers, of course, for tuning in as well. Remember to subscribe to our YouTube channel. I'm Andrea Sankey. We'll see you next time.